All right, so how does hip osteoarthritis start, or what is it? Essentially, the hip joint is a ball and socket joint. Between the ball and the socket, you need to have a space. What has happened with Mr. Ashcroft is the space between the ball and socket has reduced, and this is what's giving him his hip pain. So what we're going to do is some mobilization of the hip joint just to free up the joint space to allow some breathing room for the ball in the socket. Let's get you to bend your knee for me. There we go. Okay, you ready, sir?
Yep.
Yeah. Okay, so let's get going. So what I'm doing here is called a lateral distraction of the hip joint. You will see that as I pull this way, the joint is opening up. Any discomfort?
No.
Any pain? All right, so what is arthritis and what is osteoarthritis? Both those terms are used very interchangeably, but arthritis commonly refers to inflammation of the joint, whereas osteoarthritis is inflammation of the joint together with degenerative changes, so loss of joint space and sometimes some bony changes, formation of bone spurs or joint sclerosis, which is when the body lays down more bone where two bones are touching each other. And that's what we've seen in Mr. Ashcroft's X-ray. We just had a quick chat before we started with our examination, and essentially what we're trying to do is put off a hip replacement for as long as we can, right?
Yeah, if you say so, Doc.